This conference will now be recorded.
Thank you, Laura. I want to thank everybody for coming this evening. Before we get started, I do want to share some events that are coming up. We are having this program tonight specifically for Autism Acceptance Month. And so we have some other programs that are related to certain celebrations throughout this month as well. This week is National Park Week, and Earth Day is coming up. And we have Roosevelt's Tree Army, the history of the Civilian Conservation Corps, which is on Thursday, April 21st at 7 p.m. So that's going to be talking about Roosevelt's New Deal and that the Civilian Conservation Corps. And then next week, and with the situation that's happening in Ukraine, we have Russia's war against Ukraine, and that's happening on Monday, April 25th at 7 o'clock. And this is going to be presented by Dr. Alexander J. Mortal, who is a professor of political science at the Rutgers University in Newark. He's going to share his expertise and knowledge regarding the causes and consequences related to the current situation in Ukraine and Russia. And again, that's on Monday, the 25th at 7 o'clock. And both of those programs are in this format on our GoToMeeting platform. So you can either go to our website, mcl.org, to register, or you can download our app, which is My MCLSNJ, and you can register that way as well. So let's get on to this evening. Tonight we have Dr. Carol Ann Blank, who has had over 25 years of clinical experience in providing music therapy across the lifespan to individuals and groups. She is board certified through the Certification Board for Music Therapists. She has provided workshops and in-services locally, nationally, and internationally to support groups, professional organizations, and teachers. And so, Dr. Blank, I'm going to go and pass it off to you.
Thank you very much. Hi, everybody. It's really nice to meet you. Thank you for taking the time out of your day to learn a little bit about music therapy and with our neurodivergent friends and loved ones. And I'd like to go ahead and share my screen with you. I want to share the screen that I really like. Let's see. That screen. And a slideshow. There we are. Okay, so here we are. Music therapy and autism spectrum disorders. Thank you very much again for having me. I see that. Okay, here we go. So this is what you're going to come away with. What music therapy is and isn't. I'll give you some examples. We're going to talk about some areas of impact that music therapy can be most helpful for, specifically for, I'm really going to be focusing on people with autism and other neurodivergencies. We're going to talk a little bit about strategies for infusing your life with music, again, specific to attention to neurodiverse and autistic children and adults. And there are lots of different music professionals, and sometimes a music therapist would be helpful, but sometimes another kind of music teacher could be the right person, and also how to locate specifically a music therapist, and how you could, some questions that you could ask or ways that you can find out the important information that you need, because it's really good. It's really important to have a good fit with your provider. I'm just going to sort of hone in on this a couple of times to ask questions at the beginning and of your time with them, and then keep an eye on an open line of communication. Board certified music therapists will be up to date on their trainings, which include mandatory ethics trainings, and these are really important. I will try every so often to remember to put in the chat important pieces of information. And the first thing I'm going to do actually is see if I can, nope, I can't do it. I'm just going to add the link, www.cbmt.org, and maybe if somebody could do that for me, that'd be fantastic. All right, next slide. So hello, this is me. I'm Carol Ann Blank, and that is my email address. I run Music Therapy Services of Central New Jersey, and this is my private practice. However, I also work for Music Together, which is an early childhood company that provides music and movement curricula for children and their families, birth through early elementary. I've worked in nearly every, well, in many clinical arenas, including state hospitals, veterans hospitals, and private practice, and nursing homes, and senior facilities. So I've only ever been a music therapist. It's the world that I know. So music therapy, what it is and what it isn't. So I want to read this quote to you. This is Oliver Sacks's, one of his many, 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 many quotes about music. This is from Musicophilia, Tales of Music and the Brain. Music, uniquely among the arts, is both completely abstract and profoundly emotional. It has no power to represent anything particular or external, but it has a unique power to express inner states or feelings. Music can pierce the heart directly. It needs no mediation. So with that being said, music therapy is the clinical and evidence-based use of music interventions by a credentialed professional for a variety of health-related purposes. And this is the definition from the American Music Therapy Association, and that is musictherapy.org. Very easy website to remember, musictherapy.org. Music therapists music therapists have to go through an academic training program, an internship, then we sit for our national board certification exam, and we have ongoing continuing education, which keeps our credential current. So the CBMT is the certification board for music therapists. They're the ones that say, yes, you have you are a music therapist, and we rely on, and we continue with continuing education in order to make sure that we stay on top of the research and trends in the field to make sure that we're doing our work. Now, I just want to say a question. There's a question about questions. Thank you, Anna. The music therapy looks different depending on the population or the person that you are serving. And since we're really focusing on autism and neurodiversity, most of my examples are going to be headed in that direction. However, music therapy can look very, very different for somebody who has cancer, somebody at the end of life, a newborn baby in the NICU, a person who's experienced trauma and is working through post-traumatic stress. It can look very, very different. So I'm going to show you. So if you have specific questions about music therapy and anything, please put them in the chat, and we'll try to get to them, as many as possible. I'm hedging that there are going to be lots of questions at the end of our time. I'm going to make sure that we have time for questions. This video is from an organization that provides music therapy services in, I believe, Australia. I can't get to my notes right now, but this really kind of shows you the one child's process and how music is instrumental in that. So I want to share that with you now.
And you know what, shout, hey! 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 If you're happy and you know it, shout, hey! Hey! Like a diamond in the sky. Twinkle, twinkle, little star. How I wonder what you are. Well done. Come on again. Look. Hi. What have we got? It's hi. Ice. Hi. Cream. Ice cream. King kicked a kettle. King kicked a kettle. That's the sound that came make. It's time to stop and say goodbye. Goodbye, goodbye, goodbye. We'll meet
Okay. I hope that gave you an overview of how the relationship between playing instruments, the responses from the music therapist, the presence of the parent to provide comfort, especially at the beginning, can sort of inform all of the understanding of how music therapy can be effective for a child who has these concerns. So let me move this over here, and then we can go that way. Nope, we got to that way again. There we go. So so music therapy is within the context of a music therapy session. Your therapist might provide reports for other providers, home play, which are some assignments, playful assignments that you and your family can do to further support your loved one's development, so that what's happening in the therapy session can have a transfer over to home and school and other places. They may provide you strategies for managing behavior through song or desensitization or other ways, and also accessing resources for accessing music in the community. So there are some in every community, there are some places and spaces where music is being made, live music is being made and shared with people that can be perfectly warm and welcoming to families with folks with diverse needs, and being able to be part of the community is really, really important. And so your music therapist might be able to also guide you to find those resources, and also to provide you the questions to ask in order for those resources, you to discover those resources quickly. Music therapy isn't solely a receptive technique. People don't just put headphones on and and this is music therapy. This is not the totality of what music therapy is. Yes, there are programs, music therapy programs that involve, or interventions that involve listening and actively listening. But there are some other programs that, specifically geared toward folks who maybe have dementia, that rely solely on listening to music as a way of providing them increased quality of life. While those are lovely, those are not music therapy because they lack the specificity of addressing concerns within a context of a provider-person relationship. And music therapy isn't provided by people who are not board certified, and it's not a substitute for other necessary services. So while music therapy can address speech, it can address attention, it can address behavior, if somebody needs a speech therapist, they still need a speech therapist. If somebody needs a different kind of professional, you still need those things. And music therapy isn't accomplished by putting on an app as a reward. There are wonderful apps that are available, and I will show you some apps. Somebody asked about apps earlier. We'll definitely get to that. But if a person is solely using music as a reward for something, then that's not music therapy. That's using music as a reward for something. And I have questions about using something that we're all culturally entitled to, as by the fact that we're humans, as only a reward. So some areas of impact. Music therapy. Did you know that music lights up the whole brain at the same time, leading to greater efficiency and the ability to access skills by strengthening the connection between different cortices? So in our brains, super quick neurology lesson, we've got visual cortexes, we've got auditory cortices, we've got motor cortices, we've got, you know, places super deep into the base of our brain. We have the fact that we breathe and our heartbeat regulates, and that's all mediated by the corpus callosum, which is this fibrous connecting tissue between the left and right hemispheres. When people listen to and or engage in music, the brain lights up very evenly, lights up the most evenly around all aspects of the brain. Super important. Why is this important, you say? First, it's the only input, non-pharmacological input, that gets the same kind of brain reactivity, that sort of co-opting all of the centers of the brain. The second is, if there is underdeveloped sections of the brain or portions of the brain that aren't working well for some reason, then by lighting up the whole brain, you're co-opting that energy and efficiency so that you can still get to the same skill. You can still get to the same outcome because we don't just listen with our auditory cortices, we listen with our whole brain. So it's when you're trying to, especially in the early years of a person's life, a child's life, if you're really trying to support their developmental milestones, you want to do it in the presence of music because their brain is like really, really active. And children are developing many, many neural pathways that require repetition in order for those pathways to be myelinated. If you establish a neural pathway and then don't reestablish or reinforce that neural pathway, brain is super efficient. It's just going to say, oh, we don't need that, and go ahead and prune that part of the neural connection because it didn't get enough myelination. So definitely, it's one of those amazing, wonderful things that music lights up your whole brain all at once so that you can make the best use of it. So music therapy research highlights. For children, music therapy has has helped to improve parent-child relationships, emotion regulation, social skills development, and communication. Again, these research outcomes or these highlights are really specific to our neurodiverse friends and loved ones. And for adults, music therapy is often used for identity formation, recreative skill building, the ability to have a hobby and engage in that hobby independently, and to deepen that hobby in connection with other people, emotion management, and also being able to relate and communicate with peers. So this is a young man and his caregiver. This little boy has some components of autism in terms of relating, communicating, and autistic-like behaviors. His primary diagnosis isn't autism, but the relating and communicating that he's really working on right now, like super hard with his caregiver in music therapy, is something that I often work on. This is just the best video that I had to show that. Right now, this young man is working really hard on expressing himself in relation to his favorite instrument, and I'll let you discover what that is.
Drum, 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 drum. Drum, 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 drum,
Drum. Drum. Drum.
Okay, I'm going to pause for a minute because we've not said any other word but drum, but we've conveyed a whole lot of meaning. We're trying to reflect his delight and his excitement, and also encourage him to continue to engage in this most precious of objects.
Drum, drum, it really is a drum. That is a drum. Yes, drum.
Okay. All right. So that is one way. I'm trying to make sure that I don't, okay. That is one way that he is looking at and trying to explore the world, and that music is helpful in that. This is him a little while later in a slightly different experience. It's more of a back and forth communication experience, still with a very preferred object.
Thank you. What a pretty thing. Is it, can you open it? That's very, no, there's nothing really in it. So,
Hold on. Where is my favorite portion of this video? I'm going to stop sharing for a second. Don't know where that video went. Okay. All right. Here we go. I'm going to share again. Share. And there we go. And see what happens when you prep your videos and then all of a sudden they go haywire, which is so weird. Okay, let's see. Crossing my fingers because it's really, really cute. No, it's not. Darn it. Okay, so, okay. If we have time at the end, I will show you, I will get that video another way. Okay, so let me go back and share my screen again. We'll move ahead. Share and present and yay. Okay, so infusing your life with music can happen in a lot of different ways, and I'm going to talk about it in three sort of buckets. Regulation. Sometimes it's really hard for folks with autism or folks who are neurodiverse to kind of let the auditory input and visual and sensorial input that is bombarding us all day long to kind of, clear it out. And so being able to shift the energy through the day from, okay, now I need to relax, or here I need to ramp up to do the thing, whatever the thing is. Music can really help with those shifting of energy through the day. So if you were a parent and you were trying to motivate your young ones to find a calming moment at the end while you're trying to do dinner prep or during dinner, singing or playing songs of a lower volume or a slower tempo may be helpful. A lot of these, since music is very individually received by the hearer, can be kind of hit or miss. So you may need to experiment with the kind of music that you or your loved one really prefers. Transitions can be difficult. So transition, of course, is that ending of one experience and moving into another experience. My favorite ways to transition or help people to experiment with transitions is to sing through the transition. So for the gentleman that I showed you the video before of, his mom said we really need a transition song, so I wrote for them, now that insert activity, now our meal is done, now our meal is done, now our meal is done, it's done. And then I just repeat, we repeat at needed, put the toys away, put the toys away, put the toys away, away. And if you are musically inclined at all, you might recognize the descending 5 tones. 5, 4, 3, 2, 1. 5, 4, 6, 5, 4, 3, 2, 5, 4, 3, 2, 1, 5, 1. So it's cadences, cadences, cadences. We're ending to help kind of move from one activity to another. And then making music as having music be accessible as a recreative activity, finding joy and delight in sharing an activity with family or friends that can be enjoyed at home or in the community, having meaningful experiences of music is important. So let me go here. Okay, so why? Why does music work? The elements of music, melody, rhythm, harmony, steady beat, and timbre, which is sound quality, they work together to organize the nervous and the motor systems. For providing energizing or calming auditory input, you're helping to train the body to understand what homeostasis feels like. So a lot to unpack here. I'm going to stop sharing just for a minute. So, okay, so let's just review what the elements of music are. This is steady beat. It's steady, that's the pulse, it's what your foot is going to tap to when it hears music. Rhythm is the pattern of silence and sounds. So that might be this little skipping. So my left hand has the steady beat and my right hand is playing a rhythm. So those are 2 of the elements. Then we've got melody. Melody is the organized notes that go in a pattern that you can recognize. This is a melody. La 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 la. That is a melody. That is happy birthday. Fun fact about happy birthday seems to have transcended many cultures and languages. I was once in a doctor's office and the receptionist was trying to get the date of birth of the little infant that was in with their parent, and there was a language barrier between the receptionist and the parent. And it was a little bit frustrating because a translator was definitely needed and they didn't have one. And so I said, excuse me. And I looked at the parent and I went, da, 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 da. And the parent went, oh, and then was able to give the necessary information. Harmony, on the other hand, is the grouping of those supporting notes that give music the quality of the sound that in our culture might make it sound happy or sad or excited or motivating. Harmony is definitely culturally constructed, and different cultures understand what beauty is, or what harmony is, or what harmonies are beautiful to them differently. So it's important to know, as a music therapist, it's important to know the cultural context of the person that you're serving to be able to serve that family well, or that individual well. Now there's timbre, and timbre is tone quality. It's a fancy word for tone quality, and that's the difference between a tambourine and a violin, what makes the sound. So some folks who are neurodiverse have a very difficult time with certain sounds, and can also really gravitate to other sounds. I have a child, he's actually mine, who would just go inside a speaker at a wedding, you know, those big, loud, he would just go inside it if you would let him. And then we have another child in our same family who would run the opposite direction. So there's lots of different ways that timbre can affect folks who are neurodiverse. Now, the organizing the nervous system and the motor system is really important, because part of what autism is a motor concern, a movement disorder. So parlaying the power of steady beat and rhythm to help organize the motor system can help movement become more fluid, if that is a concern. Now, calming and energizing the brain and the nervous system is also something that is often really helpful and part of helping autistic and neurodiverse folks to cope in the world, because the world is so chaotic and they're on high alert all the time, or they can be on high alert much of the time. So training your brain and training your body to feel what homeostasis, what sort of a well-run engine feels like, can be a real freeing experience and skill to learn, so that they can remain self-regulated and engage in the world around them with less distress. So that's why music works, because the elements of music work really hard to make sure all of that is happening. So this young man is finding a way to communicate with me. We're finding our ways to communicate together using the piano. And this getting to the piano, he loves his piano. Only certain people in his life are allowed to play the piano. I was not allowed to touch the piano for the first 6 months that we worked together. But then eventually I was allowed to come to the piano. He and I here are improvising. I'm playing a song that he knows, and he is improvising on top of it. And I'd like to share this with you. That's him playing. Okay, let me move this back over to here. And that. Okay, so I want to point out that if you have someone who is neurodiverse in your life, a big sound doesn't necessarily mean dysregulation, and that there are lots of different ways to express music and to express sound, and sometimes the mouth noises or movements can be, and we often look for these to shape them into more musical and meaningful communication. These stems are not something that we typically work to extinguish because they are important parts of our folks' identity and ways to self-regulate. And so we want to make sure that they're honored in their individuality in all ways. So finding the right fit, it's all in the relationship, just like every other helping profession. So choosing a music professional, I encourage you to look for maybe statements in their documentation that explain their understanding of inclusion or accommodation, and do they have a willingness to learn about you or your loved one? If they use the words, tell me more about your child, tell me more about what you're looking for, and do they have a clearly articulated philosophy, or can they clearly articulate a philosophy about who can and should be involved in music? There are some places who have a very strict Western music education focus, and maybe that's not the right place. And then there are some places that are different, that you're really looking for a flexible approach to teaching. And this can be anything from early childhood music programs to private lessons to in any instrument or group lessons or conservatory, or this is, or even choir or band in your children's school. You're really looking for ways that your loved one can access music, and these are some things to look for when you're talking to people like that. So choosing a music therapist, look for the MTBC credential. Definitely you want to hear music therapists say, tell me more. What would you like to know? Tell me more about your person, what you're hoping to experience. Look for their training and expertise in accommodating neurodiverse learners. Can they synthesize your concerns and wishes into coherent statements? Well, I hear you saying, and this is what I can offer. Describe the therapy process to your satisfaction. When you're done with this conversation, do you have a real sense of how this could be helpful to the person that you love? And some folks offer a screening session, and that may be of use to you as well. Okay, so that is the end of my spiel. I'm gonna stop sharing so that I can address some questions that I had gotten earlier. Some people had asked about apps. This is an iPad. I have found that the apps that I have found have been more likely to be on Apple rather than Android. I hope that changes because I am a devout Android user. But I really like Incredibox. Incredibox is an app, and you can also use it on a PC. It's got 8 different sound banks, and they're all different sounds. So I'm just going to choose the first one, and you can press there. And then there are these guys, they're a little naked, but it's not too bad. And then you dress them by adding accessories from down here, and they have different sounds. So be quiet a minute. I'm gonna. I can't catch you in the morning. So that's Incredibox, and every. Well, stop. Okay, so all of these are different. All of the 8 things are different sounds, different qualities of sound. How do I make you go away? I want to make you go. There we go. Another app that I really like is called Keezy, 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 and it's again with sound samples. I'm gonna just lower the volume a little bit on this guy. It has different choices of sounds that you can. Hello, can't you choose? Now playing. Okay, here we go. There we go. I changed it to the harp setting. And now it's not playing, which is very sad. There we go. You can play two at once. And these are just lovely ways to kind of, I think my screen is dirty. These are lovely ways to have some sounds. You can also record your own sounds into these 8 boxes, and that is super fun. Keezy also has Drummer, Keezy Drummer. And this is a different, these are ways to make sample sounds for just a variety of different rhythmic patterns. Chrome Music Lab, CHROME Music Lab. If you Google that, you will get so many cool desktop or laptop based apps for music making. The visuals are very clean, so they do, some of them look more young, but see, that's it. But I've used them with a lot of different people and they're super, super cool. Some of them are cooperative so that you can be in different places and actually play the virtual keyboard together, which is fun. I just did that with a bunch of college students a couple of weeks ago. Then there is the one other one for some of our friends who have more motor-based concerns, where moving is important. Where is it? It's called AUMI, AUMI. AUMI is the app. These are all free apps that I'm telling you about. This one has different boxes, and if you move, it's really hard to do this right from here because this red button, okay, that red button is supposed to go somewhere on your body, your arm, your head, and then as you move, that red button moves and plays the different songs or instruments. So that's how that works. It takes a little bit of getting used to, but it's highly customizable. So there's one other app if you have young children and you're really looking for, yes, thank you, adaptive use musical instrument. If you're looking for some free songs that are really geared toward young children, the Hello Everybody app is there. I like it because it allows the voice, you can fade the voices out and sing your own words to songs. And if you're a Music Together family, you get more songs that you can add to this app. So those are some of the things that I wanted to share with you today. I hope that this was interesting and that you have more knowledge than you came here with, and I can take questions.
Thank you so much. I have to tell you that I am a huge Incredibox fan. I use it with my younger son constantly, and so much to the point that my older son is now into using it as well. So when I saw that pop up, I'm like, yes, I love it. One of the things that I really enjoyed that you brought up in your presentation was you were talking about how, and I really felt like this is important to talk about, is that it really depends on who you're working with. I mean, just one neurodivergent person is different than another, and there's different needs, and I think that's very important to point out. And I love that, you know, listen to the therapist and make sure that they are understanding your child. So I really do appreciate you emphasizing that point. I do think that's very important. Um, I also thought it was, and I don't know if you can speak a little bit more to this. There are some questions, but I just, people, I do want to invite people to ask their questions into the chat box, and I do have a couple to pose to you.
Okay.
You had talked about communication,
Mhm.
and there's the communication, like just the back and forth, but then there's pragmatic communication. Like, and I think you kind of touched on this with like relating to people, like how, the appropriateness of asking something and how to ask it. Is that something you've seen with music therapy used for in that aspect?
Right. So yes, there are ways to do that through sometimes rote song learning. Like, okay, this is how you. One of my favorite stories. I came in to a session, and a neurodiverse friend of mine was learning all about small talk, and so he gave me all his small talk things all at once, and then he said immediately, "We're having a nice conversation," and I said, "We are. Let's talk about pacing a little bit." And so musically, we kind of do that in a couple of different ways. I do it a couple of different ways. I play a musical question, and then they have to wait before they answer it. And then I sing what the question was too, and then they respond in the normal socially acceptable kinds of ways. So sometimes this is where you're getting that co-opting the energy of the brain. When you're singing something, your brain is lighting up, and so if you're singing it, you can then get it a little bit more ingrained quickly, and then fade out the singing, but keep the rhythmic speech. Then fade out the rhythmic speech so that prosody becomes the way you're doing it. So, how are you today? I am fine. 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 How are you today? I'm fine. So I just did like a year's worth of work in 5 seconds. But yeah.
Well, I think anybody who has worked with any kind of services, you know that it is a time that it's persistence and it's repetition, and it's a time component. And I also appreciate you bringing up, you know, that this is one therapy and it can be used with other therapies that may be important for your child or your young adult or your adult who you're trying to work with. I do have a question here that can music therapy be used to reduce one's self-talking behavior, calm anxiety, and do you have any suggestions on what instrument therapy one should use?
So
That's a lot going on.
right, yeah. So I'm assuming that the first part of the question refers to the some of the undercurrent of talking that some folks engage in, where they're perseverating over saying stuff over and over again, and there's an anxiety component to it, and maybe sort of ruminating on events or something. When I hear that or I see that, I sometimes interrupt it by playing something long and quiet over with it, over top it. It depends on it depends on the person I'm
Yeah.
serving. Often these things are processes that are very difficult to address directly. So you kind of have to go sideways next to it to understand what it is, acknowledge the anxiety, reassure that everything's okay. Is there something that we can talk about? Or if we're just in a stem, and this is just a thing. Okay, now we just have to do something completely different. Let's have a drum, or let's have a tambourine, or let's have a, and sometimes music can be a good interrupter of those kinds of moments. Singing, if you're singing a song that you know, you can't also be saying the things that are right. But then as the therapist, I'm also looking at, am I just escalating this behavior? Or are we substituting something more calming for something that is distressing? So in terms of instrument therapy, I'm not, if you're talking about instruments that a child should learn as a way of helping, if there is an interest in an instrument, that's the instrument the child should be learning. This is regardless of how their brain is constructed. If your child is fascinated with drums, that's the instrument for them. If your child is fascinated with piano, then that's the instrument for them. There's no one instrument that's better or worse. There is also the challenge of finding good sensitive providers who can teach instruments or can provide, so like those are the reasons that I really honed in on the questions that you really should be asking and getting answers from in order for folks to find quicker, because they do exist, but sometimes they're gems that you have to go through to find others. Here is an example of a question that I had to ask a piano teacher, and this was in my own house with my own kid, and my daughter was exhibiting some signs of frustration. It was the very first meeting, signs of frustration and overwhelm. And so at the end of the meet and greet lesson, she left, and I said, so how do you address signs of overwhelm or stress in your students? And he very nicely listed all the things that I would expect somebody to list. And then I said, and which of those did you do with my daughter? And he didn't even realize that she had been overwhelmed and stressed. And it wasn't like a secret. I was handing her tissues. So, so like you can get the really good answers, but then you also kind of sometimes have to see in the moment how the interaction goes. So needless to say, that was not a good fit for us, and we found somebody else. So are there other questions?
I want to check with our Hickory Corner branch because I know they have people in person there, and to make sure that they don't have any questions there. I don't see any coming in. So I think that they might be okay.
Good.
Give them 1 second here. Okay. So I think that is all of our questions, and I do that people have as of right now. I do appreciate you sharing your knowledge and your expertise, and I just think it was a fascinating program. I learned things to look for, etc., which I think is really important to give us those tools and those questions to ask. So I do want to thank you. I want to thank everybody for attending this evening. I hope to see you at future programs. And I cannot forget to thank Laura, who is behind the scenes for our IT department, making sure everything runs smoothly. So thank you to everybody and have a lovely evening.
Thank you. Thanks,
Thank you
Sharon.
so much.